before proceeding with the video, I request each one of you to hit the subscribe button and turn on the bell icon for notifications on upcoming videos. I must say here that each like, comment, and share you all do on these videos can make a huge difference to this channel. So please keep supporting my work with your likes, comments, and shares. Oral candidiasis is a fungal infection of the oral cavity caused by Candida albicans. Candida albicans is part of our natural microflora, or let's say they are the microorganisms that commonly live on the skin or the mucous membrane of the human body. Candida can be found on the skin, in the GI tract, the mouth, and the vagina. Most importantly, it loves moist and warm environments like mucosal lining in the oral cavity or the vagina and the diaper region of babies. They are opportunistic microbes, meaning that they can cause disease only when an opportunity is provided to them, like in the case of a weakened immune system in certain diseases, or in cases where there is less competition between microbes, such as in those taking broad-spectrum antibiotics where most of the bacteria die and adequate space is left behind for Candida overgrowth. Candida albicans may exist in two forms, that is, the unicellular or the yeast form and the multicellular or the hyphae form. The yeast form is responsible for the transfer of infection from one part of the body to the other, while the pseudohyphae is responsible for invading deep down into the tissue. Since we said that C. albicans is part of the microflora, most importantly a part of the oral microflora, about 30 to 50% of people simply carry the organism in their mouths without clinical evidence of infection. At least three general factors should be present to determine clinical evidence of existing infection with C. albicans. These are the immune status of an individual, the oral mucosal environment, and the strain of C. albicans. Based on these three factors, infections can range from mild superficial mucosal involvements in otherwise healthy individuals to fatal disseminated disease in severely immunocompromised patients. Let's talk about the clinical presentations of oral candidiasis. Oral candidiasis may exhibit a variety of clinical presentations. These clinical presentations are either acute or chronic and are of three types. These are the Pseudomembranous Candidiasis, the Erythematous Candidiasis, and the chronic Hyperplastic Candidiasis. Most of the individuals will display only a single pattern, however, some may exhibit more than one clinical form of oral candidiasis. Pseudomembranous candidiasis is the most common clinical presentation of oral candidiasis. It can either be acute or chronic. This form, when affects the oral cavity, is also known as oral thrush. It's characterized by the presence of white plaques on the oral mucosa that resembles cottage cheese or curdled milk. The white plaques are composed of tangled masses of Candida hyphae, yeasts, desquamated epithelial cells, and debris. These white plaques are mostly distributed on the buccal mucosa, the palate, and the dorsum of the tongue, and these white plaques can be removed with a tongue scraper. That's why it's called pseudomembranous, which means that it's not a true and a well-attached membrane. Pseudomembranous candidiasis affects individuals with a weakened immune system, like in newborns, and in elderly individuals or those with an immune disease like diabetes. It can also be initiated by the use of broad-spectrum antibiotics, hence reducing the amount of bacterial oral flora and providing quite adequate room for these fungi to undergo cell divisions as much as they can, resulting in disease. HIV and leukemic patients can also initiate this infection. Symptoms are relatively mild, consisting of a burning sensation of the oral mucosa or an unpleasant taste in the mouth. The erythematous candidiasis is usually more common than pseudomembranous candidiasis. This type also can represent either in an acute form or a chronic form. The term erythematous refers to the red color of the lesions, sometimes associated with ulcerations. Several other clinical presentations can be observed in this type, which may be acute or chronic. These are acute atrophic candidiasis, central papillary atrophy, angular cheilitis, and denture stomatitis. Acute atrophic candidiasis, also known as antibiotic sore mouth, because it forms after a course of broad-spectrum antibiotics. In this clinical presentation, patients often complain that the mouth feels as if a hot beverage had scalded it. The burning sensation is usually accompanied by a diffuse loss of the filiform papillae at the central part of the dorsal tongue, resulting in a reddened, bald appearance of the tongue. Patients who suffer from xerostomia due to any reason have an increased prevalence of acute atrophic candidiasis. The central papillary atrophy, also called median rhomboid glossitis, is a well-demarcated erythematous zone in the midline and the posterior dorsum of the tongue and is usually asymptomatic. The erythema is due to the loss of the filiform papillae in this area. Angular cheilitis, which is another type of erythematous candidiasis, involves the angles of the mouth and is characterized by erythema, fissuring, and scaling of the corners of the mouth. This condition can also be observed in older edentulous individuals with the reduced vertical dimension of occlusion and accentuated folds at the corners of the mouth. Saliva tends to pool in these areas, keeping them moist and thus favoring candidal infections. Denture stomatitis is the next form of erythematous candidiasis characterized by varying degrees of erythema localized to the denture-bearing areas of a maxillary removable denture. This condition could be caused by an improper design of the denture, causing unusual pressure over mucosa, allergy to the denture base, or inadequate curing of the denture acrylic has also proven to be a cause of the denture stomatitis. Chronic hyperplastic candidiasis is the third next and least common form of oral candidiasis. Other names for it are chronic plaque type or nodular candidiasis. This type is characterized by hyperkeratotic irremovable plaque type lesions located on the anterior buccal mucosa, which cannot clinically be distinguished from a routine leukoplakia. The diagnosis is confirmed by the presence of Candida hyphae associated with the lesion and resolution of the lesion with antifungal therapy. Treatment for oral candidiasis depends on the severity and type of the Candida infection. Treatment of oral thrush can be done with antifungal drugs like nystatin suspensions. More severe forms of the disease can be treated with azoles and amphotericin antifungal medications. If you think this video has really helped you, please take few seconds to like and share this video with your friends. Every subscription here you give can make a huge difference to this channel. That's why I request every one of you to hit that subscribe button and turn on the bell icon to get latest updates on upcoming videos. Thank you for watching.